Here's a recent interview that aired on Newsmax featuring two guests. One is a self-described gender justice, whatever that means, PhD named S.J. Miller. And then there's an actual physician named Greg Marchand. And I want you to watch what happens when the gender justice PhD claims that it's totally normal for men to lactate and breastfeed. It's a fascinating exchange. Watch.
What we know is that biological men are actually able to breastfeed. We also know that men who take hormonal supplements, might
naturally
be able to. Yeah, there are studies that show that.
Where is that?
Oh, I don't know where the study is, but you'll have to look it up. It is in the research, and I'm sure the doctor on the call here can attest to that.
Doctor, is this? Obviously, we're probably talking about like 1 in a billion, or is this something that actually happens like regularly in nature?
As you said, it is quite rare, but it is possible for a man to naturally breastfeed, particularly men that have tumors, cancerous or benign tumors of the pituitary. Breastfeeding or lactation is a common side effect. So, as you said, a very, very rare event, but it can happen naturally. A tumor can form in the pituitary that'll have otherwise a normal biological male and make them start to lactate. Obviously, anybody who has that symptom should seek medical attention right away.
Yeah, that best advice of the day right there, doctor.
Yeah, this is, by the way, I've had this exact conversation, not about male breastfeeding, well, that conversation too, but the part where the gender justice person says, well, there are so many studies that show this. There are so many studies out there that prove I'm correct. What studies are those? Well, I don't know the studies exactly. I just know that they're out there somewhere. They're floating on the breeze, the studies are. Very many times, that's exactly how it goes. And by the way, the other thing too is that, yes, it's true that men with severe medical conditions like cancer have been known in rare cases to lactate. But here's the thing. You don't take those excretions that you are excreting because you have cancer and feed them to a baby. So is there any study that shows that a man can can healthily sustain an infant on the substance coming from his nipples? And the answer to that question is no. So the gender justice trans PhD S.J. Miller tries to pass off the idea of men lactating as the most natural thing in the world, but he has no medical studies to back that up, none that he can name. So flails a bit. He asks Greg for assistance, at which point Greg tells him that men lactating is actually a symptom of a serious medical problem like cancer. Now, this whole thing is beyond parody. And the whole interview went on like this. The gender justice PhD just sits by as the real doctor repudiates everything he says. And this is not to pick on just one activist PhD, because again, this is happening everywhere, from Mount Sinai to UCLA and everywhere in between. Everyone knows what's going on here. Activists who support the idea of male lactation don't actually care about the life or well-being of the infant. What they're concerned with is promoting the fundamental tenet of the religion that is transgenderism, which is that nothing is more important than the affirmation of the trans person's feelings. So the only question that matters to them when it comes to male lactation is, does it make the trans-identified male feel good to have this happening and to be breastfeeding a child? Does it make him? That's the only question that matters to them. Whether it's good for the child is irrelevant. It doesn't matter. What we know is that all other humans on Earth, including and especially their families and children, exist primarily to affirm them, the trans-identified individual. If children have to die or have their lives ruined to validate the delusions of mentally ill men, then so be it. They're a necessary sacrifice. That is their view. It used to be that trans activists and medical professionals would never say anything like this out loud. For a long time, deliberately hurting children was a red line in American politics and in American medicine. And even trans activists weren't dumb enough to cross that line. They were happy to worship indigenous people, quote unquote, including tribes that conducted human sacrifices on children like the Aztecs, but they would never come out and endorse those human sacrifices themselves. Or if they did, they would call it reproductive health care and hope that nobody asks any more questions. But we're now getting to a point where the drive to sacrifice children on the altar of affirmation isn't even being papered over with euphemisms anymore. They're not even bothering to do that. Now our supposed public health experts are coming right out and admitting what they've wanted to do all along, which is to harm and even kill children to make self-identified trans people feel better.